What is the role, function of the placenta? Primary site of nutrient and gas exchange between mother and fetus. What are the fetal components of the placenta? Cytotrophoblast and syncatiotrophoblast. What is the maternal component of the placenta? Decidua basalis. What is cytotrophoblast? An inner layer of chorionic villi. Which fetal component of the placenta makes cells? Cytotrophoblast. The outer layer of chorionic villi. Syncatiotrophoblast. What is the role of syncatiotrophoblast? Synthesizes and secretes a hormone. What is the main hormone produced by syncatiotrophoblast? HCG. What is HCG? Hormone produced by syncatiotrophoblast, structurally similar to LH. A secondary role of syncatiotrophoblast. Stimulates corpus luteum to secrete progesterone during the first trimester. Why is the syncatiotrophoblast not attacked by the maternal immune system? Lacks MHCI expression. Placental component derived from the endometrium. Decidua basalis. Maternal blood in lacunae. Decidua basalis. What are the components of the umbilical cord? Umbilical arteries 2, and umbilical vein 1. What is the role of the umbilical arteries? Return deoxygenated blood from fetal internal iliac arteries to the placenta. Role of umbilical vein. Supplies oxygenated blood from placenta to fetus. What structure drains into IVC via the liver or via ductus venosus? Umbilical vein. Which structure in the umbilical cord has deoxygenated oxygen in the blood? Umbilical arteries. What is an associated pathology of the umbilical cord? Single umbilical artery. The umbilical arteries and umbilical vein are derived from the underscore. Allantois. What structures are derived from the allantois? Umbilical arteries and vein. What structure is produced at the third week of gestation from the yolk sac? Allantois. The allantois extends into underscore. Urogenital sinus. What is urachus? The duct between the fetal bladder and umbilicus. The duct between the fetal bladder and umbilicus. Urachus. The allantois becomes the underscore. Urachus. Failure of urachus to involute can lead to anomalies that may increase the risk of infection and/or malignancy if not treated. What is the obliterated urachus? Median umbilical ligament. What does the urachus become after birth? Median umbilical ligament. What is the patent urachus? The total failure of urachus to obliterate to urine discharge from umbilicus. What is the key feature, symptom of patent urachus? Urine discharge from umbilicus. Partial failure of urachus to obliterate. DX. Urachal cyst. What is the urachal cyst? Fluid-filled cavity lined with uroepithelium, between umbilicus and bladder. Painful mass below the umbilicus, which often is infected. DX. Urachal cyst. Slight failure of urachus to obliterate. DX. Vesicorchal diverticulum. What is the pathology of the outpouching of the bladder? Vesicorchal diverticulum. Associated pathologies of the vitelline duct. Vitelline fistula and Meckel diverticulum. At what week is the vitelline duct obliterated? 7th week. Another name of vitelline duct. Omphalomexenteric duct. What is structures are connected by the vitelline duct? Yolk sac to midgut lumen.